my name's Tara. I'm going to be your nurse today. I'm here to do your cardiovascular and lung assessment. Can you tell me your name, please?
Pierre,
And what is your date of birth?
May 3rd, 1975.
Would it be okay if I gave you a cardiovascular and lung assessment today, Pierre?
Yes.
Thank you. Cleaning my hands first. First, we're going to assess your carotid arteries. I'm going to turn your neck this way a little bit and sort of palpate just inside your sternomastoid. Find a pulse. We're going to take a quick listen just to make sure we don't have any thrill or bruise. Good. +3 carotid pulses. I'm going to check the other side. No thrill or bruit over there. And I want you to turn back towards me this little bit. And we're going to look here at your jugular vein. Going to palpate at your sternal notch to try to find your pulse there. And then we're just going to trace it up a little bit. Find the point of maximum impulse. Right. And the other side as well. Just a mild amount of jugular vein distension. And going forward, I'm going to assess your pericardium. I'm just going to be inspecting all of the points above your various valves. I'll be palpating them with my hands, looking for any lifts or bounding pulses or masses, and then I'll be auscultating with both my diaphragm and my bell to hear your heart sounds and detect any murmurs. I'm going to go down to your second clavicular space on the right side of your sternum, and then straight over to your second clavicular space on your left side. Going down to your third, fourth, and fifth intercostal spaces, known as Erb's point. And then we're going to come over to your mid-clavicular line and palpate that same fifth intercostal space. Now we're going to listen with the diaphragm. We should hear good S1 and S2 sounds at all of the points. At your atrial valve, it should be S1 is louder, and as we get over here to your mitral valve, it should be S1 is, did I say S2 the first time or S1 the first time?
S1.
So S2 should be more audible here, and S1 should be more audible here. No extra sounds or split S2s. Over to the apex of the heart, where we should have the point of maximum impulse, and I'm just going to count out your pulse for a minute here. got 63 beats per minute with a normal range being between 60 and 100, so that's terrific. And I'm just going to auscultate a little bit deeper and listen for a murmur. Don't detect any murmurs. I'm going to go ahead and listen to your lungs at this time. I'm going to start at the apex of your lung. Every time you feel my stethoscope, I want you to take a nice deep breath, okay? Again. And we're just going to inch down to your upper lobes. Again, and down to your lower lobes. Nice deep breath. Great. Have you been having any shortness of breath or coughing? Okay. I want to have you sit up a little bit. You can sit right up here on the side of the bed. And I'm going to listen to your posterior lung sounds, starting again with your apex. Go ahead. And we're just going to inch down little by little between your shoulder blades. Again. Last one. Again, I'm hearing a little bit of dimness down in this left lung. So make sure that you're getting plenty of exercise and you're taking deep breaths. Go ahead and lay back down for me, please, Pierre. We're going to assess your peripheral vascular now, starting with the abdomen. I'd like to note that your abdomen and your chest are both very symmetrical. I don't see any bounding pulses or use of accessory muscles when you're breathing. And so first I'm just going to palpate a little bit into your abdomen and find your peripheral abdominal, starting right here in your epigastric region. You have a nice scar in your belly. What's that from?
Car accident.
Good pulses there. I'm just going to follow this out down to your iliac. Great pulses. I'm going to go ahead and palpate into your inguinal folds for your femoral pulse. Normally we would be doing this without the clothes, but for the purposes of the video, we're going to keep our clothes on. I can still feel your femoral pulses. Nice quality. Thank you. And then I'm just going to take a listen and see if I can hear your peripheral vasculature in your abdominal cavity and just detect any thrill or bruise. It's not really that easy to auscultate, to be honest. All right. Moving on to the arms. I'm just going to assess to make sure that all of your extremities are nice and warm, that you don't have any edema, which you don't, and that you have good capillary refill. Beautiful. I'm going to check your pulses, your brachial pulses. Very strong, +3. Your radial. Again, very strong. And we're going to do this arm as well. You damaged your nail bed there. Good brachial pulses there, and radial pulses. Moving down to the legs. Again, just nice and warm. No edema. Good hair growth down the legs, which is a sign of good peripheral vasculature. I'm going to have you bend your legs one at a time. And I'm just going to palpate your popliteal artery, which is here behind your knee. Great. Moving down to your tibial pulses. +2. And your dorsal pubis pulses. Good, +3. Relax this leg down for me. I'm going to check this leg. Good, +2 quality there. Again, good, +2 quality there. Good, +3 quality there. Last, I'm just going to check you for a Hohmann sign, which would be an indicator of a possible DVT or deep venous thrombosis. I want you to flex your foot like this. And I'm just going to gently palpate your calf. Any pain there, Pierre?
No.
And the other leg? Wonderful. I want to thank you so much for your time. And this will conclude our assessment. You can go ahead and get dressed after I step out.